Good day to everyone. This is Dr. Wilson-King from Victory Rejuvenation Center. Today's video is going to be about dysmenorrhea. Dysmenorrhea means painful menstruation. Dysmenorrhea is also the leading cause of recurrent short-term school absence in adolescent people and a common problem in people of reproductive age. A better definition is painful menstruation of sufficient magnitude to incapacitate day-to-day activities. In the United States, 600 million working hours or $2 billion is lost annually due to severe dysmenorrhea. And that's a CDC.gov statistic. But let's look at it another way. People who menstruate generally from the age of 12 to the age of 51 for 3 to 7 days. So that means 456 periods over 36 years represents 6¼ years of life in constant pain. Remarkable. Sounds very uncomfortable, doesn't it? Now, the title of the talk was the dysmenorrheas. Well, there's two kinds of dysmenorrhea. There's primary and secondary. Primary dysmenorrhea usually has no pathology. It is confined to a cycle in which ovulation occurs. The pain is usually with the menstrual cycle, that is, while the person is having menstrual bleeding, and it's limited to that time. Secondary dysmenorrhea commonly has pathology and impairs people typically between the ages of 30 and 45. The pain can be during the menstrual period, before or after the menstrual period, virtually any time during the monthly cycle. Endometriosis is the most common cause of secondary dysmenorrhea. Other causes include uterine fibroids and adenomyosis. Now let's talk about the current treatment for dysmenorrhea. The most commonly used medications are non-steroidal anti-inflammatory drugs, or oftentimes nicknamed NSAIDs. Examples of NSAIDs are ibuprofen, naproxen, diclofenac. Naproxen is often called, the brand name is Anaprox, and the brand name for ibuprofen is Advil. They are over-the-counter and have been proven effective for use in dysmenorrhea. For best results, you should begin the NSAID 1 to 2 days prior to the menstrual period and take when you have dysmenorrhea. Now, the NSAIDs can have side effects. They include indigestion, stomach ulcers, headaches, and drowsiness, and sometimes dizziness. Then there are the really rare instances of heart failure, heart attacks, strokes, kidney issues, and liver problems. Using NSAIDs a few times a month is probably not risky and does not increase your risk for severe side effects. However, those people with secondary dysmenorrhea often use the drugs more frequently and on a long-term basis. This increases their risk for the adverse effects, including the rare cases of kidney problems, liver problems, and strokes. Other treatments for dysmenorrhea, the second most common treatment is suppression of the ovaries with combined hormonal contraception, known as birth control pills. It is really the second most common defense used, and it often can be first line of defense if contraception is needed, as well as treatment for the dysmenorrhea. People in their 20s and 30s with secondary dysmenorrhea can be placed on these synthetic hormones for prolonged periods of time. Generally speaking, this is not a problem, but it can potentially be a problem. The use of combined hormonal contraception is contraindicated, meaning people should not take. People with specific medical problems, such as smokers over the age of 35, those with a history of blood clots, some with hypertension, or lifestyle behaviors that put them at an increased risk. These include obesity, elevated cholesterol, uncontrolled hypertension, or others. We also cannot forget that there are many people who do not wish to take synthetic hormones for varied reasons. This is where cannabis can be very helpful. Cannabis is a medication with an excellent safety profile and very low risk of adverse effects. Specifically, high CBD products are very effective. High CBD means the CBD amount in the product is higher than any other phytocannabinoid. And generally, these products may or may not contain THC. CBD is a pain reliever, anti-inflammatory, antidepressant, and anti-anxiety. It also does not cause impairment. A product that has multiple, you want a full extract CBD product, meaning it has other phytocannabinoids in it. So you don't want to do just, well, you can, single molecular CBD. I find that the full extract products are more effective. Plant medicine, you want to use all the constituents of the plant because they work together very well like that. You don't have to. You can do single molecular, especially if you need higher doses. So, I'm going to recommend that you see a cannabis specialist for assistance. Now, of course, I have to say Victory Rejuvenation Center does consultations on patients all over the country. Please feel free to contact us for a consultation and management and treatment advice. Be sure to follow us on all social media platforms. Please remember to like, share, and subscribe. Visit us at victoryrejuvenationcenter.com. Thanks for watching. We'll see you on the next video.